There are many reasons why we would need to call 911 for our individuals. Here is a list of some of those common reasons. However, if someone needs first aid care and you are unsure of what action to take, always err on the side of being overly cautious. Call 911. You will never be in trouble for initiating that emergency response system. When we're concerned about someone's breathing emergencies, we want to watch out for unusually slow or rapid breaths, breaths that are unusually deep or shallow, any wheezing or gurgling, making high-pitched noises, or gasping for breath. Someone's skin might be unusually moist, and they'll either be flushed, pale, or have a blue-like appearance. Someone could also feel short of breath for no obvious reason. Also, it's important to keep in mind that people have different pain tolerances, and many of our individuals are unable to accurately describe their pain or where they hurt. So it's important that we all understand how our individuals behave when they are acting comfortably. If someone is profusely bleeding, having shortness of breath, exhibiting any cardiac symptoms, or a change in someone's level of consciousness, never transport to the doctor or the hospital on your own. Call 911 and let paramedics determine if an individual needs to be brought in, and they will transport. If at all possible, we want to send someone else to
If at
make
all
a call to
possible, we
911
want to send somebody
while we
else to make
stay
that
with our
call to
individuals.
911 while we stay with
Some
our
of the things
clients.
to include on that phone
Some of
call
the
to a
things to include
dispatcher
on
would be
that
the
phone call to the
location of the
dispatcher
incident.
would be the
So make
location
sure
of
we
the
know where
incident.
our program's
Perhaps if
addresses
you're
are
on an
posted.
outing, are there any
Perhaps if
intersections or
you're on an
landmarks that can
outing,
make your location
are there
easily
any
recognizable?
intersections or landmarks that can
What
make
type
your
of emergency
location
is it?
easily
Do fire,
recognizable?
medical, or police personnel need to
What
arrive?
type of
How
emergency
many
is it?
ill or injured
Do
persons are
fire,
involved?
medical, or police
What,
personnel
if any,
need to
care has been
arrive?
given and by who?
How many ill or
And
injured
it's
persons
important
are
to not
involved?
hang up first.
What, if
Dispatchers are
any,
trained to
care has
help
been
you
given
and
and
provide
by who?
instructions over the phone.
And it's
They will tell
also
you when it's
vital
okay
not to hang up the
and they
phone
may just stay
first.
on the phone with you the entire
Dispatchers
time
are
until
trained
emergency
to help
personnel
you
arrive.
and
It's also
provide
important that
instructions
they
over the
have the
phone.
accurate phone number
They will
of the
tell you when
phone
it's
that
the
you're calling
appropriate time
from.
to hang up.
If you're using the landline at your
Dispatchers may
program
also just
or
stay
your
on the
personal
phone with
cell
you
phone,
the entire
they need to be
time
able to
until
reach
emergency
you in
personnel
case you
arrive.
get disconnected.
It's also important that they have the accurate phone number of the phone that you're calling from. If you're using the landline at your program or your individual cell phone, they need to be able to reach you in case you are disconnected. Mild abdominal discomfort is something that is common and is usually caused by something gastrointestinal, such as indigestion or constipation. If we know that one of these two things is the culprit behind someone's abdominal pain, some things that we can give our individuals for comfort would include Maalox or Tums, or perhaps stool softeners or milk of magnesia. Of course, we always need to refer to the approved over-the-counter medications that have been approved for use by the individual's primary physician. Some non-pharmacological interventions for stomach pain would be peppermint and chamomile tea. We also want to try to avoid carbonation if at all possible, because these bubbles can irritate the lining of someone's stomach and it could make that discomfort worse. Even though abdominal pain is common and oftentimes not life-threatening, we still want to obtain medical advice if that stomach pain is accompanied with a fever. If someone is unable to keep food down, especially if it lasts for several days. And also someone who is unable to pass stool that's also accompanied with vomiting. any painful or frequent urination, and also if someone's stomach is tender to the touch. We want to seek immediate medical attention by calling 911 if there is blood present in someone's vomit. Sometimes this will look like coffee grounds. If there's any bloody stools, if there's any difficulty breathing, if that person is pregnant, or if that pain starts to radiate into the chest, the neck, or the shoulders. After we have performed first aid for animal bites, we should also be applying an antibiotic ointment. And this is also listed on our individual's over-the-counter PRN sheets. When it comes to animal bites, we need to keep in mind that vaccinations play a vital role in both the health for the animal and for you. Rabies vaccines are good for 1 year if that dog is a puppy, and every 3 years when they're an adult. However, some states do require that rabies vaccines need to be done annually, and also a tetanus vaccine is good for 5 to 10 years. Regardless of the animal that did the biting, we want to always seek medical attention if that bite was strong enough to break the skin and cause bleeding. First aid care for human bites is the same as animal bites, except we don't need to worry about diseases like rabies. However, human bites have an extremely high risk of infection. So if that bite breaks the skin enough for someone to bleed, seek medical attention. This would also be considered an exposure incident. Common blisters that are caused by friction or ill-fitting clothes can simply be monitored and covered with a Band-Aid and an antibiotic ointment. It's important to remember to never pop a blister to drain the fluid out, because that is the most likely time that infection could set in. You want to seek medical attention for a blister if it is caused by a burn or by chemicals. You should always suspect a fracture or a serious injury and call 911 when the following signs are present. There is a significant deformity in the affected limb. Bruising and swelling are present. The person is unable to use the affected body part normally. Bone fragments are sticking out of a wound. The person feels bones grating, or they heard a snap or pop at the time of the injury. The injured area is cold and numb. Also, if the cause of the injury suggests that the injury may be severe. It's important to never splint a fracture unless you are in a remote area and help is going to be delayed a significant amount of time. The reason that we don't want to splint a fracture is we can cause more damage that way. If you suspect a fracture or a serious injury and you have already called 911, you should stay with the person and keep them from moving the affected body part until emergency personnel arrive. Another name for a bruise is a contusion, and it's important to remember to not apply heat to a bruise because that heat can increase inflammation and can make the bruise worse. You should also not give aspirin or ibuprofen for a bruise because this can prolong the bleeding time. First aid for bruises include icing the area off and on for the first 24 to 48 hours.
You want to apply ice or a cold compress for about 15 minutes every hour, and always put a barrier like a towel or a washcloth between the ice and the skin. Rest the affected area. If possible, elevate the affected area. Remember the acronym RICE, which stands for rest, ice, compression, and elevation. For pain, take Tylenol. You should seek medical attention for a bruise or call 911 if that bruise is accompanied by extreme pain and swelling, the bruise is on the face or the head, you can't move a joint, or you think that there is a possible fracture. When it comes to first aid for burns, the very first thing we want to do is determine what type of burn that it is. There are 3 degrees of burns, and they are determined by the depth of the damage that burn caused to the skin. A general rule when it comes to burn care is we want to first stop the burn, cool the burn, and then cover the burn with a dry, sterile dressing. First-degree burns, otherwise called superficial burns, only damage the top layer of skin, and this is the type of burns that sunburns are. And it's only the type of burn that can be treated with an antibiotic ointment. So to help prevent sunburns, apply sunscreen. The average dose of sunscreen for an adult is 1 ounce, and always remember to check the expiration date on the bottle of sunscreen you're using. Limit time outdoors, especially in the summer, and remember that the warmest part of the day is from noon to 3 p.m. A second-degree burn damages the top layer of skin as well as the second layer of skin, called the dermis. And you can tell the difference between a first-degree burn and a second-degree burn by the fact that there are blisters present. It's important that we submerge these types of burns in standing cool water instead of under running water, because that flow could cause more damage to the skin tissue. Also, do not apply antibiotic ointment to this type of burn, because ointments are petroleum-based and can actually trap the heat of the burn and make the damage worse. And do not break the blisters, because this could lead to infection. These types of burns always need to be seen by a doctor. Third-degree burns are the most serious of all types of burns, but not necessarily the most painful. Sometimes the nerve endings are burnt away. You may see where the skin is charred black, or you may see into the white inner layers of the skin. This type of burn always needs to be seen by a doctor. Call 911 and let 911 transport to the hospital or burn unit. Do not apply antibiotic ointment to this type of burn. You may cover with a dry, sterile gauze dressing. However, third-degree burns need to be cleaned and cared for by trained medical personnel. If a burn is caused by a chemical that is liquid, use lots of water to wash the chemical away, but don't use lots of force, or this can cause that chemical to spread. If it is caused by a dry chemical, put on gloves and brush that chemical away. If a burn is caused by electricity, do not offer assistance until you make sure the electric source has been shut off. Look for both an entry wound and an exit wound. The exit wound is often found on the bottom of the person's feet and is often worse than the entry wound. Both wounds need to be treated as separate burns. Monitor the person's airway, breathing, and circulation. Electrical burns could damage the heart. A burn is considered critical if a burn occurs and the person has breathing difficulty. The burn covers more than one body part. The burns are to the head, neck, hands, feet, or genitals. The burns, other than the very mild one, is to a child or an elderly person. And the burns resulted from chemicals, explosions, or electricity. Critical burns always need to be seen by a doctor. Call 911 for a critical burn. A person's airway is roughly the size of their little finger. And if a person is choking, but they're able to speak or cough, encourage them to continue to cough. If they can no longer cough or speak, stand at the side of the person and use the heel of your hand to give 5 back blows between the shoulder blades. If the object does not come out, stand behind the person, make a fist with your hand, and give 5 abdominal thrusts right above the belly button. Continue these 2 steps until the object comes out or the person becomes unconscious. If they become unconscious, slowly lower to the floor and begin CPR immediately. You can also simply administer abdominal thrusts until the object comes out. If someone is pregnant and you suspect that they are choking, abdominal thrusts can still be given right below the breasts. If the person is in a wheelchair, use the back of the wheelchair as leverage and administer abdominal thrusts. For a cold, get plenty of rest, drink plenty of fluids, and cough syrup may help relieve the symptoms, though they will not prevent or shorten the duration of the cold. Cough syrup should be administered at bedtime if the person is having trouble sleeping because of the coughing episodes. Ideally, cough syrup should not be used during the daytime or awake hours unless it is an expectorant, which means that it thins out secretions so they're easier to expel. Gargling with warm salt water may help if a sore throat is also present, but make sure the person understands the difference between gargling with salt water and swallowing the salt water. Acetaminophen can help with a fever, sore throat, headache, or body aches. But most importantly, wash your hands often. If someone has a history of seizures and it's a documented diagnosis, you do not need to call 911 if they have a seizure. However, you do need to call 911 if something happens in conjunction with that seizure, such as the person hitting their head. If this is a first-time seizure for that individual, the person has a seizure lasting more than 5 minutes. The seizure occurs while the person is in water. The person has a different type of seizure than they normally have. If someone is having a seizure, do not hold or restrain that person. Do not place anything in the person's mouth. Remove any nearby objects that might cause injury. Cushion the person's head using folded clothing or a small pillow, and stay with that person during the entire seizure. Never leave them alone. Time the seizure from the beginning of the movements to the end of the movements, because this is information that health professionals are going to want to know. After the seizure, lay the person on their side to facilitate breathing and keep the airway open if that person is vomiting or they have extra saliva in their mouth. The reason that we don't restrain someone during a seizure is that you could do more damage that way. And a seizure is considered a prolonged seizure if it lasts more than 5 minutes. Someone who has diabetes, their body doesn't produce enough insulin to regulate the sugar that's in their blood. So they have to regularly monitor their blood sugar levels for readings that are too high or too low. This is called hyperglycemia or hypoglycemia. If someone is diabetic and all of a sudden they start acting funny, that may be a sign of hypoglycemia. If you are unable to take a blood glucose test, treat that person for being hypoglycemic. If the reaction is due to hyperglycemia, the treatment for hypoglycemia is not going to do any further damage. For a hypoglycemic reaction, give the person some type of sugar. And this can be regular soda, fruit juice, milk, or candy. And some people also carry glucose tablets, which they can take in place of giving them something sweet to eat or drink. And the dosage of glucose tablets is 4. For a moderate reaction, you may see someone that has increased confusion or mild combativeness. A more severe reaction, you would see someone that looks intoxicated, like slurring their words or difficulty with ambulation. If left untreated, a person with a hypoglycemic reaction could become unconscious. Some people also have no signs or symptoms when they are having a hypoglycemic reaction, and this is known as hypoglycemic unawareness. We typically don't need to call 911 if someone is having a hypoglycemic reaction. However, if there is no improvement in their behavior 5 minutes after the extra sugar is administered, or if that person becomes unconscious, call 911 immediately. For occasional bouts of diarrhea, you can use a PRN medication called Imodium and follow the directions on the box. If you have diarrhea, your body may lose lots of fluids, so the main concern is dehydration. Someone who is dehydrated might have extreme thirst, less frequent urination, or not being able to urinate at all, dry skin, fatigue, or lightheadedness. If someone becomes dehydrated, increase their fluid intake. Drink at least 8 ounces of fluid an hour. And drink rehydration drinks like Gatorade or sports drinks. If someone has diarrhea, avoid any spicy foods, fruits, alcohol, and caffeine until 48 hours have passed and all symptoms are gone. Avoid milk for 3 days after symptoms disappear. If someone has chronic diarrhea or diarrhea lasting longer than 2 weeks, this could be a sign of a more serious medical issue, and you should contact the person's primary care physician. There are two main categories of adult ear infections: acute middle ear infections and outer ear infections. Most ear infections in adults are outer ear infections, also known as swimmer's ear. Signs of an ear infection include ear redness, itchiness inside the ear, flaking of the skin of the ear, drainage from the ear, which may be pus, pain when moving the head or touching the ear, and a fever. Most ear infections will get better with the following treatment: using acetaminophen for pain, applying heat to the ear, which may help with the pain. When applying heat, use a warm washcloth, and also encourage rest. Swimmer's ear is sometimes treated with antibiotic ear drops. Sometimes pus and debris will need to be cleaned out by a physician. And if someone has chronic ear infections, they should be seen by an ear, nose, and throat specialist on a semi-annual or annual basis. Some of the causes for external bleeding include an abrasion. This is caused by a foreign object rubbing against the skin, but usually does not penetrate the skin. Excoriation is caused by mechanical destruction of the skin and usually has an underlying medical cause. Lacerations are irregular wounds caused by blunt impact to soft tissue overlying hard tissue or any tearing of the skin. Puncture wounds are caused by an object penetrating the skin and underlying layers. Incisions are a clean surgical wound caused by a sharp object, usually a knife, and a contusion, which is also known as a bruise. When it comes to treatment for external wounds, remember the acronym RED, which stands for rest, elevation, and direct pressure. Rest. The less movement the wound undergoes, the easier the healing process will be. Rest will also reduce the pulse rate. Thus, it will also reduce the severity of the bleeding. Elevation. This only works if the bleeding is to the limbs or head and is not appropriate for body wounds. Have the person hold their wound as high as possible. If the legs are affected, have the person lie on their back and elevate their legs. Direct pressure. The most important step is to apply direct pressure, and this is simply placing pressure on the wound in order to stop the flow of blood, and this is best done utilizing a sterile gauze pad. The dressing should be tight, but not so tight that it cuts off blood flow below the bandage. To check if a bandage is too tight, perform a capillary refill check by holding the hand or the foot, depending on what limb is bleeding, above the level of the heart, and firmly pinch the nail. If it takes more than 2 seconds for the pink color to return under the nail, then the bandage is likely too tight. If blood starts to come through the dressing, add additional dressings. Do not remove the dressings that you've already placed. If bleeding does not stop in a short amount of time, call 911 immediately and let them transport to the hospital. Heat exhaustion is one part of the spectrum of heat-related illnesses that begins with heat cramps, progresses to heat exhaustion, and finally to heat stroke. The body cools itself by sweating and allowing that sweat to evaporate. This requires enough fluid in the body to make sweat, air circulating across the skin, and low enough air humidity to allow that sweat to evaporate. Activity in a hot environment can overwhelm that body's ability to cool itself, and this can cause heat-related symptoms. The most common signs and symptoms of heat exhaustion include confusion, dark-colored urine, dizziness, fainting, fatigue, headache, muscle cramps, nausea, pale skin, profuse sweating, and rapid heartbeat. Heat exhaustion is usually not a medical emergency because there's all types of interventions we can do. Treatment for heat exhaustion includes recognizing the symptoms, stopping the activity, moving to a cooler environment, rehydration with water or sports drinks, drink plenty of fluid if they're alert, remove any tight or unnecessary clothing, Take a cool shower, bath, or sponge bath, and apply other cooling measures such as fans or ice towels. You should be able to see an improvement within 30 minutes. If symptoms persist longer than that, seek medical attention. Remember that certain medications can cause a person to overheat very rapidly. Heat stroke is when the core body temperature is above 104 degrees or higher, and the body's cooling system is completely overwhelmed and stops working. Signs of heat stroke include incredibly hot skin, and this is the most common sign. Dizziness and fainting, extreme fatigue, nausea, and if this happens, start drinking water immediately. Vomiting, this is a definite sign of heat stroke. Rapid heartbeat, mental confusion, seizures, lack of sweat, and severe headache. If you suspect heat stroke, you should immediately seek medical attention. Injuries to the eye are the most common preventable cause of blindness. So when you're ever in doubt with eye injuries, err on the side of caution and seek medical attention. For routine irritations, wash your hands thoroughly before touching the eyelid to examine or flush the eye. Do not touch, press, or rub the eye itself. And do not remove any foreign body except by flushing, because of the risk of scratching the surface of the eye. Tilt the person's head over a sink with the affected eye down and gently pull down the lower lid, encouraging that person to open his or her eyes as wide as possible. Gently pour a steady stream of lukewarm water from a pitcher or faucet over the eye. Flush for up to 15 minutes, checking every 5 minutes to see if the foreign body has been flushed out. Because a particle can scratch the cornea and cause an infection, seek medical attention if there is any irritation to the eye after it has been flushed with water. If the object is not dislodged by flushing, seek medical attention. If an object is embedded in the eye, seek medical attention and call 911. Cover the affected eye with a small cup taped in place, and bandage both eyes since the eyes move simultaneously. Keep the person as calm as possible until emergency personnel arrive. If there are chemicals in the eye, flush the eye with lukewarm water for 15 to 30 minutes and seek medical attention. For black eyes, apply cold compresses intermittently, 5 to 10 minutes on, 5 to 10 minutes off. Use cold compresses for 24 to 48 hours, and then switch to applying warm compresses. If there is pain, offer acetaminophen. Prop the head up at night and encourage that person to sleep on the uninjured side of the face. You should seek medical attention for black eyes if there's an increased redness or discharge, there's persistent pain, a change in vision, any abnormality of the eye, and if there's visible bleeding within the white part of the eye. For dizziness or lightheadedness, lie down for a minute or two, and this will allow more blood flow to your brain. After lying down, sit up slowly and remain sitting for 1 to 2 minutes before slowly standing up. Do not drive a motor vehicle, operate equipment, or climb on anything while dizzy. Do not use substances that can affect your circulation, including caffeine, tobacco, or alcohol. And do not get dehydrated, which can cause or increase lightheadedness when you have an illness that can cause diarrhea, vomiting, or a fever. You should seek medical attention for fainting or dizziness if there's nausea or vomiting that persists or increases. Fainting occurs and it doesn't stop, and your symptoms become more severe or frequent. If someone falls on the floor, do not immediately help them up off the floor. Leave them on the floor and have them move their body parts themselves. Do not have them move body parts if you suspect a fracture. If you do not suspect a fracture or serious injury, offer minimal assistance with getting the person off the floor. You shouldn't immediately help somebody off the floor because you could cause more damage. What should you do if you suspect a fracture? Call 911 and stay with that person and keep them from moving any body parts and keep that person calm. Head injuries include a concussion, which is the most common type of traumatic brain injury in which the brain is shaken, scalp wounds, and skull fractures. Head injuries may cause bleeding on the brain tissue or in the layers that surround the brain, and symptoms can occur right away or may develop over several hours or days. For a moderate to severe head injury, always call 911. If that person's breathing and pulse rate are normal, but the person is unconscious, treat it as if there were a spinal injury and stabilize the neck and spine. Stop any bleeding by pressing a clean cloth on the wound. If you suspect a skull fracture, do not apply direct pressure to the bleeding site. If the person is vomiting, roll that person's head, neck, and body onto his or her side. It is important to not wash a head wound that is deep or bleeding a lot. Do not remove any objects sticking out of a wound. Do not move the person unless absolutely necessary. Do not shake the person if he or she seems dazed. And do not remove a helmet if you suspect a serious head injury. Some signs of a mild concussion include confusion, clumsiness, headache, ringing in the ear, nausea and vomiting, memory problems, dizziness and balance problems, slowed reaction, and light and noise sensitivity. If these symptoms occur for 15 minutes or less, they can be considered a mild concussion. Signs of a severe concussion include seizures, slurred speech, blood or clear fluid draining from the ear, abnormal eye movement, repeated vomiting, coma, unequal pupil size, walking issues, and weak muscles. Always seek medical attention if you suspect a concussion. Symptoms of frostbite include part of the person's body or skin turning white and hard or black. The person has lack of feelings in that area, and the person is showing signs of hypothermia. If you suspect frostbite, call 911. Until EMTs arrive, get the person to a warm place and remove any wet clothing. Unless absolutely necessary, keep the person from walking on frostbitten toes or feet. Do not rewarm the skin unless you can keep it warm. Warming and then exposing the frostbitten area to cold air can cause worse damage. Gently warm the area in warm water, not hot, or with wet heat until the skin appears red and warm. If there is no water nearby, breathe on the area through cupped hands and hold it next to your body. Do not use direct heat from heating pads, radiators, or fires, and do not rub or massage the skin or break any blisters that could form, because you could do more damage to the underlying tissues. For a simple headache, stop the pain with acetaminophen. Drink plenty of water, since dehydration can cause a headache to get worse. Find a dark place to relax for at least 30 minutes. Use a cool compress to your forehead, as this can help blood vessels constrict, which may ease some of the pain. Massage your scalp, neck, and earlobes, as this can distract from the pain as well as improve circulation and relieve tension. Practice relaxation techniques such as meditation and deep breathing. Seek medical attention quickly if you have a headache that feels worse than any you have ever experienced before. Change in the type of headache you usually experience. A headache that feels unfamiliar or abrupt. Headache that worsens over days and it doesn't stop. Headache with neck pain or fever. This could be a sign of meningitis. Headache accompanied by seizures, vomiting, inability to tolerate bright lights, rashes, weakness in any part of the body, or personality changes. A heart attack is something that can occur at any age. The signs of a heart attack include chest pain, discomfort, pressure or squeezing that lasts longer than 3 to 5 minutes and is not relieved by resting, changing position, taking medications, or that goes away and comes back. Discomfort or pain that spreads to one or both arms, the back, the shoulder, the neck, the jaw, or the upper part of the stomach. Any dizziness or lightheadedness, trouble breathing, nausea or vomiting, pale or gray skin, sweating, a feeling of anxiety or impending doom, extreme fatigue, and unresponsiveness. Men and women may have very different signs. Men often have more of the pain associated with a heart attack, such as the chest pain, more classic symptoms. Women's symptoms can be so vague and nonspecific that they may have signs or symptoms lasting for hours, days, or even weeks leading up to the heart attack. If you suspect someone had a heart attack, the first thing you need to do is call 911. Give the person 4 low-dose 81 milligram aspirin tablets or 1 full-strength 325 milligram tablet, only if they are responsive and able to take aspirin. Have them break the aspirin apart with their teeth and chew to swallow. We don't have them swallow the aspirin with water because it will take too long to get into their bloodstream that way. You want to loosen any tight clothing. And if the person is prescribed a medication for chest pain, oftentimes nitroglycerin, assist that person with taking their medication, which is a small pill that dissolves underneath the tongue. Have them rest and sit on the floor, not on the couch or in bed, because if they go into cardiac arrest, you will be in the perfect position to start CPR. There are multiple reasons why we could have nausea and vomiting, such as motion sickness, early stages of pregnancy, medication-induced vomiting, intense pain, emotional stress, gallbladder disease, food poisoning, infections, overeating, a reaction to certain smells or odors, brain tumors, concussions and brain injuries, ulcers, certain forms of cancer, bulimia or other psychological illnesses, gastroparesis, otherwise known as slow stomach emptying, or the ingestion of toxins or excessive amounts of alcohol. The timing of the nausea or vomiting may indicate the cause. For example, if it appears shortly after eating a meal, this could be because of food poisoning, gastritis, an ulcer, or bulimia. Usually vomiting is harmless, but it may be a sign of a more serious illness. A concern with vomiting is dehydration. You should seek medical attention for vomiting if that vomiting lasts for more than a few days, or if there is a possibility of being pregnant. Dehydration is present, or a known injury has occurred, such as a head injury or an infection that could be causing the vomiting. If there's any blood in the vomit, this could be bright red in color or look like coffee grounds. That there is severe tiredness, confusion, or decreased alertness. If there is severe abdominal pain, if there is a fever above 101 degrees, if there's diarrhea, or if there's rapid breathing or a pulse. Some things that you can do to prevent nausea from developing are eat small meals throughout the day instead of 3 large meals. Eat slowly. Avoid hard to digest foods. Consume foods that are cold or room temperature if you are nauseated by the smell of hot or warm foods. Rest after eating with your head elevated 12 inches above your feet. Drink liquids between meals instead of during meals, and drink at least 6 to 8-ounce glasses of water per day, and try to eat when you feel less nauseated. For nosebleeds, pinch the soft part of the nose firmly between the thumb and forefinger, just below the end of the bone. Have the person sit with their head slightly forward and breathe through their mouth. Never tilt the head backwards, as this may cause vomiting or choking. And if the nose is still bleeding after 10 minutes, seek medical attention. Do not wait 10 minutes if that person is on aspirin therapy, Coumadin, warfarin, Jantoven, Plavix, etc. If you suspect someone has been poisoned, call poison control immediately. Their number is located on this slide and on the inside cover of any phone book. Water can be given to dilute the poison if that person is conscious and able to swallow. Do not induce vomiting unless you have been instructed to do so by poison control. Anything burning going down the esophagus will also burn coming up the esophagus. There are 4 main types of shock: psychological shock, circulatory shock, anaphylactic shock, and toxic shock. For psychological shock, you want to have the person lying down and elevate their feet 10 to 12 inches. When they sit up, have them do so slowly and pause for a minute or two before they stand up again. For circulatory shock, have the person lie down and elevate their feet 10 to 12 inches. Control any external bleeding and help the person to maintain normal body temperature by covering them in a blanket. A person is often very cold, even if it is warm and sunny outside. Do not give the person anything to eat or drink, even though they often are thirsty. This could become a choking hazard if they become unconscious, and it is also possible that they may need surgery if that shock is caused by internal or external bleeding. It's important to always call emergency medical personnel if you suspect circulatory shock. The treatment for anaphylactic shock is call 911. Have that person sitting up because that is the easiest position to breathe. Administer epinephrine if available. If an EpiPen is not available, try to administer Benadryl if this is available. The treatment for toxic shock is to call 911. That person needs to be seen immediately and started on IV antibiotics. Symptoms of a stroke include sudden trouble speaking, trouble ambulating, confusion or vision problems, loss of balance, a sudden headache, dizziness, or sudden numbness or weakness in the legs, arms, face, or one side of the body. Stroke symptoms usually come on abruptly, but may occur gradually over a period of hours. If you suspect a stroke, remember the acronym FAST. F. Look at their face and have the person smile. Look for any drooping or for their smile to be asymmetrical. A. Have them hold out their arms and look for weakness on one side. S. Say a simple sentence and have them repeat it back to you. Listen for any slurring of their words. And T. If you notice any of the above, note the time that those symptoms began and call 911 immediately. To remove a tick, use fine-tipped tweezers. If you don't have tweezers, put on gloves and use your fingers. First, grab the tick as close as you can to its mouth. This is the part that is stuck in your skin. The body of the tick will be above the skin, and do not grab the tick around its swollen body because you might push infected fluid into your body. Pull the tick straight out until its mouth lets go of your skin. Do not twist the tick because this may break off the tick's body and leave the head in your own skin. Do not try to smother a tick that is attached to your skin with petroleum jelly, nail polish, gasoline, or rubbing alcohol, as this may increase your risk of infection. Do not try to burn the tick while it is attached to your skin. And put the tick in a dry jar or a Ziploc bag and save it in the freezer for later identification, if necessary, if the bite does not go away. Wash the area of the tick bite with warm soap and water. If a bite becomes extremely irritated, apply antibiotic ointment and cover it with an adhesive dressing. After you remove the tick, wash your hands well with soap and water. If the redness increases or the swelling increases, be sure to seek medical attention. A normal body temperature is 98.6 degrees Fahrenheit or 37 degrees Celsius. A temperature is considered elevated if it is above 100.4 degrees Fahrenheit. Normal body temperature varies by person, age, activity, and time of day. Your body temperature is usually highest in the evening, and it can be raised by physical activity, strong emotions, eating, heavy clothing, high room temperatures, and high humidity. Infections are the most common cause of elevated temperature. If a fever is mild and no other problems are present, no medical treatment is required, but you may want to drink fluids and rest. Things that you can do to reduce a fever is do not bundle up someone who has the chills. You want to remove excess clothing or blankets. A lukewarm bath or sponge bath may help cool someone with a fever. Do not use cold baths or alcohol rubs because these cool the skin but often make the situation worse by causing shivering, which then raises the core body temperature. You want to drink cool liquids as tolerated, and also give acetaminophen to help reduce the fever. Seek medical attention if that fever lasts longer than 48 to 72 hours in adults. If anyone has a fever over 105 degrees, unless it comes down readily with treatment and that person is comfortable. Also, if there are worrisome symptoms such as irritability, confusion, difficulty breathing, stiff neck, inability to move an arm or a leg, or it's a first-time seizure. Blood pressure measures the force of circulating blood on the walls of the arteries. Blood pressure is taken using two measurements: systolic, measured when the heart beats, also when the blood pressure is at its highest, and diastolic, measured between heartbeats, when the blood pressure is at its lowest. To take a blood pressure manually, have that client sitting up or lying down. If sitting up, make sure the feet are flat on the floor without the ankles or legs crossed. Have the person resting with their arm and place the cuff on the upper arm with the arrow in the crux of the arm. Turn on the machine and it will quickly tell both the blood pressure and the pulse. You can take a pulse using your fingertips pressed against the radial artery, but be sure to not use your thumb because you'll feel your own heartbeat. If you're unable to take the pulse with your fingertips, you can take an apical pulse by listening directly to the heart using a stethoscope. Bloodborne pathogens are infectious microorganisms in a person's blood that can cause disease in humans. The three that we are going to be most concerned about today are HIV, hepatitis B, and hepatitis C. HIV stands for the human immunodeficiency virus. It harms your immune system by destroying the T cells that fight infection, which leaves you susceptible to all different types of infections, especially rare infections that someone with a normal strength immune system would be able to fight off. Hepatitis B and hepatitis C are two viruses that attack the liver, causing inflammation and fast-acting, as well as possibly long-term chronic liver diseases. When we discuss potentially infectious fluids that could contain bloodborne pathogens, we want to be most concerned about blood. There are multiple routes of transmission of bloodborne diseases, including sexual and surgical medical reasons. So it's important just to treat all body fluids in situations where you're not sure where it came from as a potentially infectious material. We say potentially because even if you are exposed to infected fluids, it does not mean that you're immediately infected. Your chances of contracting a bloodborne disease from a needle stick or injury is about 1 in 200, which just means that the potential is there. Non-potentially infectious materials mean that you aren't at an immediate risk of catching a bloodborne disease if you are exposed, but they can still transmit germs, such as flu or the cold virus, and proper care and PPE must be utilized when handling these substances. If you are exposed to any of these non-potentially infectious materials, except sweat and tears, we do treat this as an exposure incident. The reason that these are considered an exposure incident is that there could be possible blood that is present that can't be seen by the naked eye. Just like in zombie movies, everyone wants to avoid being infected by the virus. And how that's done is blood or infected body fluids are directly introduced into the bloodstream. Methods for exposure would be needle sticks or cuts. Infectious materials coming in contact with the mucous membranes of the eyes, nose, mouth, or of broken skin. Bites, or any splashes and punctures caused from daily cares. Examples of ways you could be exposed in the workplace include performing first aid or personal cares, and you come in contact with someone else's body fluid, and you have cuts on your hands or hangnails. If someone bites you and the skin is broken. If someone spits at you and enough of that saliva gets in your eyes or your mouth. Perhaps you're doing an AccuCheck or administering insulin, and you accidentally poke yourself with a needle or a lancet that has someone's blood on it. Accidents do happen, and if you are unsure if the incident is considered an exposure, always report it. Err on the side of being overly cautious.
If you happen to become exposed, don't panic. We have a set list of steps for you to follow. Step 1 is to get the material off of your body as quickly as possible. Whether that be rinsing out a wound, rinsing out your eyes, your mouth. If you need to change your clothes. If we're working with human beings, it is a good idea to keep a spare set of clean clothes in your work cubby or in your car, just for these types of reasons. Follow any first aid in case that exposure happened from an injury. Once you yourself are okay, you're going to notify your program director right away. If your program director isn't available, any of the senior directors are available to assist you if you call the main office. Within 24 hours, you're going to fill out an exposure incident report. On this report, we have a description of what happened, what body fluid you were exposed to, and the action, meaning how did it happen? Was it a bite? Was it a needle stick? Was it a scratch? On the back of the form, you have some options. If you haven't been vaccinated against hepatitis B before, you do have the opportunity to become vaccinated. The hepatitis B vaccine is a series of 3 shots. One is given immediately, the next is 1 month later, and the last is given in 6 months to slowly build up that immunity. You can also choose to have your blood tested or have the individual's blood tested. If you choose to have your blood tested, you'll be tested twice over an extended amount of time for HIV and hepatitis B. If the individual's blood is tested, they will be tested only 1 time for HIV and hepatitis B. And if they're negative, it's just assumed that you are negative as well. That being said, all of our individuals' medical history are freely accessible to the staff that care for them. So if there is a history of bloodborne pathogens, that information is not hidden from you. And of course, DRCC will pay for any costs, any testing, any vaccinations that would result from an exposure incident at work.
We can avoid exposure incidents if we stay safe and think ahead. Treat all blood and body fluid spills as if they were potentially infectious. Wear appropriate PPE, like gloves, goggles, etc. Clean up contaminated broken glass with tongs, forceps, or a brush and dustpan. Never pick up sharp objects with your hands, even if you're wearing gloves. Handle all trash as if it contains sharps or infectious items. And I bolded this one because washing our hands is the most efficient and easiest way to decrease your chances of transmitting germs. Bacteria will often get on your hands and fingers, so if you're smoking or you eat, it goes directly into your mouth. Sing the ABC song twice through and have your hands pointed downward when you're rinsing the soap off. And finally, place all potentially infectious materials and contaminated items in closable containers or bags. The bags must be color-coded. They're usually red or bright orange, and they're marked with a biohazard label. Check with your program director for proper procedures, and make sure you know where these biohazard containers are.
When you are preparing medications, this should be your top priority. So it is important to limit any distractions. It is perfectly acceptable to ask a coworker to assist you with your duties, or to tell an individual that they may need to be patient and wait while you focus on preparing medications. With each medication that you are passing, you need to consider the 5 rights of medication administration. Those are the right dosage, the right route, which means we know how that medication is administered, the right time. At DRCC, we have an hour before and an hour after window that medications can be administered. If it is given outside of that time frame without prior approval from a licensed individual like a nurse or a pharmacist or a doctor, that would be considered a misdose and a medication error. We want to make sure that we are checking for the right person's medications and also the right medication name. We review these 5 rights of medication administration by comparing the label of that particular medication to the information that's presented to us on the MAR. And we want to compare the MAR to the label a total of 3 times with each medication that we set up. The only medication that we do not need to wear gloves when administering are oral pills and liquids. If you are administering eye drops, ear drops, using a feeding tube, administering any topicals or any treatments that would expose someone's skin, we always need to be wearing gloves. Staff are also allowed to split medications if necessary. However, we need to be sure that that medication is scored. And what that means is there's a line directly in the middle of that pill. And when we split it at that line, there are 2 equal half doses. When you are splitting a medication, we must use an approved pill splitter. We can't break that pill with our fingers or use a spoon or a knife. Medications that can be crushed need to be mixed with yogurts or applesauce or pudding and put into a small med cup, enough to be taken in 1 bite. We don't want to dump the granules in a large bowl of pudding or applesauce because the person might decide that they're not hungry and might not finish it, and then they won't get the proper dose for their med pass time. Because not all medications are able to be crushed, we can find out all about medications by looking into a nursing drug guide handbook. We can also look at the computerized printout sheet that come from pharmacies. And also feel free as a staff for DRCC to call the pharmacist and ask them any questions. They are used to receiving calls about medication administration. Each individual should have their own designated medication area. This could either be a separate shelf or a drawer or a cabinet. However, everything must be clearly labeled with their names, and all medication storage areas need to be kept locked at all times. And the keys to those areas are either in our pocket or they're stored in your program's office. We can't leave keys sitting out on a countertop or sitting in the lock. Also, within that medication area, medications that are taken by mouth have to be kept separate from other routes. This is to prevent any type of medication that should not be ingested being put into someone's mouth. They could be divided by using a separate container or a divider of some sort, even just a plastic baggie. They simply cannot be touching medications. Medications that require refrigeration need to be locked in a lockbox within that fridge. And the key to that lockbox is also locked up. Narcotic medications are stored using a double-locked system, and a med count is administered before and after that narcotic is given. There needs to be a witness signature, however, and a witness does not necessarily need to be present while administering a narcotic. Narcotics are oftentimes analgesics for pain, And if you are working alone or staff is on an outing or someone is experiencing pain, we are not going to deny them their right to take that medication. In that situation, you would administer that narcotic as prescribed and perform the med count and witness signature when another staff was immediately present again. Everyone has a right to refuse their medications. If someone doesn't want to take their meds, simply explain how those meds are going to be beneficial and give them space to cool down. Approach the subject again, and if they are still refusing, simply take any prepared medications and put them in an envelope properly labeled and placed in their medication storage area to be properly disposed of. On the MAR, you want to put a capital R where your initials should be placed. We're going to write a medical note explaining that situation, and we also need to write an incident report anytime a medication is refused. If someone vomits, simply clean up the mess and write a medical note about what happened. We do not want to re-administer those medications because we don't know how much has already been absorbed into their bloodstream. If any medication drops on the floor, accidents always happen. Just pick up those medications and again place them in an envelope that's properly labeled and put them in the medication storage area to be disposed of. We also need to write a medical note explaining the circumstances of those medications being wasted, because perhaps that medication may need to be reordered when a medication is due.
When a medication is due, we need to remember that there is an hour before and an hour after window that medication can be administered. If you do not have prior authorization from a nurse or a doctor to give outside of those parameters, it is considered a medication error. If you administered a double dose, missed a dose entirely, or given medications to the wrong person, these are also considered medication errors. You need to notify your program director immediately, and also notify a doctor, a nurse, or a pharmacist to get some direction on what to do next. And you also need to fill out an incident report. Incident reports are located on Staff Resources in the Medical Documents tab. They're all online and easy to fill out and print. There are all types of reasons why we need to fill out an incident report, and they are all listed on the form itself. Typical standard of this form is explaining what happened, the staff response, any doctor recommendations, and who all you notified. Incident reports go to your program director, the case manager, their guardian, the program manager, and myself.
If you are handwriting a medical note, only use blue or black ink. If you make a mistake in medical notes, draw a thin line through the error and initial. These are considered legal documents that can be used as evidence in investigations and gone through by health services. So it's important that we don't appear as if we're hiding information. Do not use a whiteout marker or scribble out errors. You will never be in trouble for making a mistake. Just document that error correctly. When we are writing a medical note, be sure to write objectively versus subjectively. What that means is that you are writing exactly what you see is happening and not what you feel is happening. For example, instead of writing Marianne is anxious, instead write Marianne is moving around the program, pacing, talking loudly. They came up to me. They told me that they were anxious. If you are the person that brought an individual to their doctor's appointment, you also need to write a medical note about that appointment. We also need to write a medical note if you have administered a PRN medication. And an hour after you have administered that PRN, we need to document how effective that medication was in relieving their comfort. This is what we call a follow-up note. If you have any questions at all regarding the content of this presentation, please feel free to contact me using any of the methods listed above. Please fill out the accompanying quiz.